Be nice. It can be as simple as that. But it means so much more. Behind the words is an action plan to promote mental health awareness and prevent suicide.
The steps are simple. Notice, invite, challenge, and empower. Let's talk about the first step, notice. Start by noticing what is right and what is good about someone so you can spot changes in how they think, act, or feel. We all experience mental health changes. Sometimes we have a bad day or even a bad week. But if you notice changes lasting 2 weeks or more, it's time to pay closer attention.
1 in 5 people will develop a mental health disorder in their lifetime. When it comes to family members, friends, and coworkers, you are someone who is likely to notice a change. Simply noticing a difference can make a difference. What should you look for? Notice behavioral changes like quitting a sport or a hobby, isolation, using alcohol or drugs to cope, frequent crying, neglecting responsibilities, or lacking motivation.
Notice physical changes like neglecting appearance or hygiene, fatigue, sleeping too little or too much, appetite or weight changes, or frequent headaches or unexplained pains.
Notice psychological changes like being quick to anger or mood swings, increased sadness, guilt, or indecisiveness, lack of emotional response, frequent self-criticism, feelings of hopelessness or loneliness, or thoughts of suicide.
All these changes may be indicators of depression. Spotting them early can lead to quicker intervention and recovery.
The next step in the Be Nice action plan is to invite. Invite yourself to start a conversation about what you've noticed. You've noticed a change in yourself or someone lasting 2 weeks or longer. What do you do next? The invite step of the Be Nice action plan involves taking a risk and reaching out. It might feel intimidating, but don't let that stop you. Invite yourself to have a simple, caring conversation.
Start by telling the person that you are concerned about them using an I statement. Can we talk? I have noticed you haven't been acting like yourself, and I'm really worried about you.
Specifically mention what they have said, done, or written that worries you.
After initiating the conversation, give them a chance to open up and listen non-judgmentally.
Ask more questions like, how long have you been feeling this way? Have you spoken to anyone about how you feel? Is there anything or anyone that has helped you in the past? Being a good listener is key.
Remember to be patient. Silence is okay. Be aware of your body language. Use comfortable eye contact and open posture.
Be honest. It's okay to say, I don't know all the answers, but let's figure them out together. Invite yourself or that person to take a mental health screening on our website. This tool is great for anyone who thinks they may be experiencing symptoms.
The results of these screenings are not a diagnosis, so consult with a doctor or healthcare provider.
Remember, this person is opening up to you because they trust you, or perhaps you're the first to notice this change. Next up in the Be Nice action plan is challenging the stigma, challenging them to access resources and seek help, and challenging yourself to ask tough questions. We've talked about what changes to notice and how to invite a conversation. Next in the Be Nice action plan is to challenge.
This step takes on a few different meanings. First, challenge the stigma surrounding mental health and mental illness. Second, challenge yourself or someone you're concerned about to seek help. Finally, the biggest challenge, ask someone who is showing warning signs if they're thinking about suicide. The number one reason people don't seek help is because of stigma. They may fear what others will think or possible consequences, such as losing their job or status. Challenge yourself to talk about mental health the same way you talk about physical health. Being open about mental health and talking about resources reduces stigma, making people more likely to seek help early.
It's important to note that help and treatment are not one size fits all. Talk therapy is a great place to start, but if that's not effective, medication may help. It might take time to find what works best. Get started by consulting a primary care physician or mental health professional. Challenge yourself or the person you're concerned about to seek the help and treatment that is right for them.
This next phase of the challenge step is critical. Ask the question, are you thinking about killing yourself? Comments like, the world would be better off without me, I wish I was dead, I just can't do this anymore. These comments should not be ignored or dismissed as a cry for attention. Studies show that asking about suicide doesn't put the idea in someone's head. In fact, just the opposite is true. It reduces stigma and shows you're there to support.
Don't debate their feelings. Instead, tell them you care. They are not alone, and most importantly, they can get help.
Challenge them to seek immediate resources like texting NICE to 741-741, calling the Crisis and Suicide Hotline at 988, calling 911, or going to the hospital.
We've noticed changes, invited conversations, and challenged stigma. Next is the final step in the Be Nice action plan. Empower. Be empowered by knowing you can impact how someone thinks, acts, and feels.
In other words, you can impact their mental health. Empower the person you're concerned about by helping them identify their protective factors. These are people, activities, or places that lessen the impact of stressors and help protect mental health. Having access to and utilizing resources can be the most important protective factor for mental health. Key resources to keep on hand include the crisis text line. You can just text NICE to 741-741, or the Crisis and Suicide Hotline. You can call 988 24 hours a day, 7 days a week.
Other resources to look into is their access to an EAP program through their employer. Students might also investigate if they have access to counselors through their school. We encourage you to search out other resources local to you and the person you are concerned about.
Other protective factors may include engaging in hobbies and community activities, volunteering, surrounding yourself with supportive family members, friends, and coworkers. You can practice self-awareness, positivity, and gratitude. Foster your personal faith or your spirituality. Build resilience and good boundaries.
You can be someone's protective factor. Your actions and well-being affects others, so empower yourself to care for your own mental health through protective factors.
Building positive coping skills can also protect mental health. A few examples of that includes listening to or playing music, cooking, playing a sport or games, enjoying nature, journaling, blogging or reading, meditation, breathing exercises or prayer, spending time with animals or pets.
Remember the steps of the Be Nice action plan. Notice what is right and what is good about those around you, and notice changes they may be experiencing. Invite yourself to start a conversation about mental health.
Challenge. Challenge stigma. Challenge individual access to help and resources. And challenge yourself to ask someone you're concerned about if they're thinking of suicide. And empower. Empower your and or their mental health with effective resources, protective factors, and positive coping skills.
Today we ask you to take this one step further. Become a Be Nice advocate. Take the pledge to incorporate the Be Nice action plan into your daily life. Receive your Be Nice action plan certificate and show those struggling with mental health they are not alone.